Welcome back to Washington Watch. Everyone has been waiting for the Supreme Court to rule on the president's health care law. We've had lots of talk saying it might have been 2 weeks ago, last week. Since they end the session next week, it probably will be next week. Polls show most folks want the Supreme Court to throw it out, but here's the problem with that. In that particular poll, a number of those people believe the law didn't go far enough, which is one of the reasons they want it thrown out. Not surprising, since opponents have spent more than $235 million on ads condemning what they call Obamacare. One way it might have all been different is if voters had demanded answers from all the candidates for Congress on where they stood on health care reform before the elections. Since we might have to go all through the process again, it's important to know what is the ask when it comes to health care. Here to talk about that is Dr. Cedric Bright, president of the National Medical Association, the group of black doctors. Cedric, first of all, welcome to the show.
Thank you.
Healthcare is a huge issue for African Americans. When you look at even when it comes to so many different diseases, we frankly rank at the top, or some say the bottom, depending upon how you want to look at it.
Exactly.
And so what is the NMA demanding of candidates who come to your organization talking about healthcare? What are you saying this is what we want on the federal level, the state, and the local level?
Well, from the state level, we want to know that they will back Medicaid, because Medicaid is the major player for the sickest and the poorest of our health system patients. Number two, we want to know that they support the Affordable Care Act for either full or partial implementation. A lot of implications behind that, and the Supreme Court decision is very large. And then thirdly, we want to know that they're going to participate at the state level with the health insurance exchanges. Mm-hmm. Those are going to be very crucial, that we make sure that people have affordable access to health insurance.
I would also think that on the local level, what voters should be saying is to these candidates, do you support these community health clinics?
Well, you know, and honestly with that, Roland, what we really look at is how are our federally qualified health centers, which are our safety net organizations, being funded. And they're majorly funded by a 330 grant, and that 330 grant under the previous administration had not had any increases for 8 years. We now have had significant increases in the 330 grant that have now allowed our community health centers to try to expand
and that grant's
some
from the federal
of their
government.
coverage. That's correct.
Right.
That's a federal government grant. The other aspect of that is, though, many of the patients that utilize those services are our working poor. They're either uninsured or underinsured. And the problem with that is, Roland, is that one of the major causes of these folks going into bankruptcy is because of health care costs. That's where the Affordable Care Act comes into play, that allowing them to be able to access or have access with some type of supplementation to get affordable health insurance that will have them to have the ability to be more proactive in their health as opposed to less reactive. We like to look at it this way. We would prefer that people stay healthy longer rather than to get well soon.
Well, I'll tell you what, those are specific things folks should be asking for, and certainly we hope our viewers will be doing so when it comes to federal, state, and local candidates running for office. Cedric, we appreciate it. Thanks a lot.
Thank you so much. Appreciate it.
All right, he's going to give me a free blood pressure check when we get done. You can tell us what your thoughts on what's to ask by logging on to tv1.tv/ask. Here's a comment already posted. B.H. Sherrod says, quote, how do we understand the value of economic development? Meaning we must go in business for ourselves, and especially opening businesses in neighborhoods that consistently suffer with blight and distress where we live. Therefore, we must ask the Obama administration to tailor programs for this endeavor. You can add your comments at tv1.tv/ask, so please log on.